Okay, so I have got my IV fluids, and I calculated my drip factor here. So we're gonna go ahead and go to the patient's room. So entering my patient's room, providing privacy, performing hand hygiene. Good morning, Mr. Foley. My name is Samantha. I'm gonna be your nurse today. Your physician ordered that you get an IV put in, so I'm here to do that. Can you please tell me your name and date of birth, please? Ferdinand Foley, 9/23/69. Matches what he said, matches his bracelet, matches my order. So we're good there. Mr. Foley, do you have any allergies? No, he does not. So we're okay there. All right, so now I'm gonna go ahead and check my fluids. So Mr. Foley was ordered 0.9% normal saline. So I have a bag of 0.9% normal saline. Fluids are clear, not cloudy. There's no particles. Bag is intact, no leaking within its expiration date. So we're okay to use this. I'm going to go ahead and hang it up on my pole here. I'm going to move this out of the way. All right, so at this time, I'm going to go ahead and grab my tubing, and I'm going to open it up. Okay. Opening it up. I'm going to remove my tape here. Okay. I'm going to grab my spike, and I'm going to grab the end that is going to get connected to the patient. And I'm going to hold these up. So I went ahead and already labeled my tubing label. So it has my today's date, which is the 4th, time 8 o'clock, and my initials. So I'm just going to go ahead and attach that to my tubing real quick. Okay. So now that I've done that, I'm going to go ahead and grab my roller clamp here, and I'm going to go ahead and clamp my tubing off. All right, tubing is clamped. So now I'm going to go ahead and grab my bag here. I'm going to invert my solution. I'm going to very carefully remove the little cap here. There's that. Then I'm going to remove my little cap from my spike, making sure that I don't touch the entry points of these. And then with a twisting and twisting and pushing motion, I'm gonna insert my spike into my bag, just making sure that I'm not touching the insides or anything like that and contaminating. And I did not, and my spike is in, so I'm gonna go ahead and hang my bag back up. So now I'm gonna go ahead and fill my drip chamber about halfway. All right, we're about halfway on that drip chamber. So now I'm going to go ahead and prime my tubing here. So I'm going to open my clamp up till I get a good flow going, and I'm going to let my fluids roll through this tubing to remove all of the air, removing all the air bubbles, and that it also is getting my tubing completely primed and ready to go in the patient, or ready to hook up to the patient rather. Almost to the end here. Okay. All right, fluid to the very end. We are primed up, ready to go. No air bubbles in my tubing. I'll go ahead and hang this up here so that's ready to go. All right, I'm gonna move this over. All right, so now that I have done that, I am going to go ahead and make sure Mr. Foley is in a comfortable position. And he is. I've got a pad underneath us here to make sure that in case we make any mess. So I'm going to go ahead, got my tourniquet, and I'm going to go ahead and apply the tourniquet real quick. I'm going to kind of put it up here towards the top. Applying it kind of snug, making sure the ends are away from where we're going to insert the IV, and they are. And with my tourniquet on, I'm going to go ahead and assess for a radial pulse. And Mr. Foley has a pulse. So with that being said, I'm going to start looking for an IV site. I'm going to work distal to proximal, and I'm going to look for a vein that is pretty resilient, soft, bouncy. I'm going to avoid any painful areas, any infiltrated or phlebitic areas, any cord-like veins, any bruising. I'm going to avoid any sides that the patient has had, like a mastectomy or an AV node dissection. I'm going to avoid any grafts, fistulas, any bifurcations. We're going to avoid all those. And I think I found a spot that I want to go in right here. So I'm going to go ahead and release my tourniquet. And I'm just going to go ahead and move it down. Okay. So while I'm letting his arm kind of rest for a second, I'm just going to go ahead and set up my supplies. So I've got my J-loop here. I'm just going to go ahead and open that. And since I already have my J-loop right here, I'm going to go ahead and flush it real quick. So I have a flush right here. These typically would come with a lid. This one does not have one. So for the sake of this, I would just remove the lid, and then I'm going to just flush my J-loop. And that removes all the air. So that is flushed. And I'm going to also kind of loosen up this cap because it's pretty tight, and that way whenever I get his IV, when I get his IV rolling, whew, there we go. That way when I get his IV going, I'm not sitting there struggling. Okay, that's ready to go in the package. My hands hurt. Okay, have my IV now. Have a 22. I'm just gonna open that, also leave it in the package there. Have my Tegaderm. Go ahead and open this. I think you can see that. And then I have my alcohol swab. Just gonna go ahead and open that and get it ready. All right, now that my supplies are all ready, I'm gonna move this over just so that you can see. So now that my supplies are all laid out and ready to go, I am gonna go ahead and reapply my tourniquet at this time. So I have already moved my tourniquet down about 3 to 4 inches from where I'm gonna do, like, actually start his IV. Ends of the tourniquet are away from where I'm starting, so they're not going to contaminate my site. And since I have my tourniquet on, I'm just going to go ahead and assess for a radial pulse. And he has a radial pulse, so I didn't include any blood flow. So now I'm going to go ahead and put on gloves. Okay. All right, gloves are on. I'm gonna get my alcohol here, and I'm just gonna go ahead and cleanse that site. I'm gonna start in the center, and I'm gonna cleanse in a circular motion going outward 2 to 3 inches. Okay. Side is cleansed. While that's drying, I am going to get my catheter ready. So I'm going to go ahead and remove my needle. Go ahead and get my skin stretched against the insertion and just kind of stabilize Mr. Foley here. So, thumb and forefinger holding my IV, bevel is up. I'm going to insert this at a 10 to 15 degree angle. All right, Mr. Foley, big poke, and 1, 2, 3, perfect. I have a flash, so I'm just going to advance the catheter just a little bit more, and I'm going to drop it flush with the skin. I'm going to keep advancing so that my needle is withdrawing and that catheter is being pushed in. I'm going to do it until the hub reaches the insertion site, and I'm going to engage my safety device with a click. There was the click. Pop my tourniquet here. Go ahead, and I'm going to stabilize my catheter. I'm going to remove the stylet here. All right, so stylet is removed. Go ahead, grab my J-loop. Okay. J-loop is removed, or the cap is removed. Getting that on there. Okay. So now I'm going to aspirate for blood. I'm just going to keep maintaining, just make sure it doesn't move the catheter, so I'm going to keep a hold of it. Aspirate for blood. Got blood return. Going to flush in a pulse light motion, so pulse, 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 3 to 5 mils. Flushing. No signs of infiltration. Looking pretty good. So I'm going to go ahead and get my tegaderm here. Tegaderm. I'm going to go ahead and put this on. All right. Okay. Tegaderm is on. I'm just going to go ahead and remove this little kind of sticker outer covering. Make sure that I get that, get it pretty secure to the skin. Looking good. I'm going to go ahead and fill out my, I don't know what I did with my pen. Oh, set my pen right here. I'm going to go ahead and fill out my label for my tegaderm. So it's a 22 gauge needle. Today is the 4th of September. It's 0800. I'll put my initials on there just in case. Alright, I'm going to remove this little label. And I'm going to set it over here off to the side. That way anybody coming in can see it, but it's not occluding our view of the insertion site. Alright, so with that being said, I am going to now go ahead and clamp my J-loop and disconnect my syringe. Now, if I had some tape, which I have a little bit right here, I'm just going to go ahead and kind of stabilize this J-loop just a little bit so that it's not wiggling around, loosening up at all. Okay, so now that we've done that, I'm going to go ahead and verbalize that I would dispose of the needle here in the sharps container, but I will show an instructor when I finish the video. So we've disposed of our needle, so now I am going to go ahead and unclamp my J-loop. I'm going to get my fluids here ready to go. Got my alcohol swab. Scrub the end of my J-loop 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to remove the cap off of my fluids. Okay. And I'm just going to hook these up. Making sure I'm not touching the inside of anything and I'm not contaminating what I just scrubbed. All right, so now I'm gonna go ahead, come over here to my roller clamp, and I'm gonna slowly open up my fluids. Okay, we are dripping. So now I'm gonna move this over here. Well, yeah, over here. And I'm going to watch my drips here and watch the second hand on the clock and set my drip rate, which was calculated to be 14 drips a minute. So moving kind of fast right now. Okay, so I have got my drip rate set to 14 drips a minute. Looking for signs of infiltration. Mr. Foley looks good. No complaints, no signs of infiltration. So I'm going to go ahead and remove my trash here. And I'm going to make sure that Mr. Foley is comfortable. Bed is in a low locked position, 2 side rails up, call light within reach. I'm going to go ahead and dispose of my gloves here. And I'm going to perform hand hygiene.